Back on the newsfeed PM, the Department of Health is calling for extra vigilance for Mpox symptoms as 3 more cases of the disease have been detected in Gauteng. 6 cases have been so far reported. All right, let's speak to the Health Minister now, Dr. Aaron Motsoaledi, to get a sense of what is going on in the country. Minister, good to have you. Thank you very much for your time. Is this a sudden occurrence as far as you can tell, or you've been aware of an ongoing local transmission of Mpox since, I suppose, the first reported outbreak? It could have been in 2022 or maybe earlier.
Good afternoon, Thabo. Good afternoon to the listeners and viewers. You will be aware that by last year, South Africa had 25 cases of Mpox, and this year there are 6 cases. So it's not something that is new. We know that Mpox is there in the country, but this particular one that has come to Ekurhuleni is quite recent.
And when you look at the strain, I suppose, of this, is it still related to the strain that we have been talking about, which has been largely coming from those who would have traveled internationally, but now is it beginning to be found here in the country as well?
Yes, no, it is related to people who have traveled outside the country. It's not something that emerged inside.
And how are we then responding to it at this particular point, except for the usual tracking of cases and making sure, of course, those who are severely affected are hospitalized, treated, and some kind of quarantine of some sort?
I'm not sure why you say except the usual, because that usual is the mainstay, is how you deal with this pandemic all over the world. We have got an incident management team, then we have got an outbreak management team, which we have dispatched to Ekurhuleni. Their job is to trace contacts and find out what's happening and see if it is spreading further than the people who have got it. So that's the mainstay. There's nothing else to do except that. And of course, treat it symptomatically, because you'll appreciate that Mpox does not have a treatment. It's like COVID. And so we treat symptomatically. But we are doing tracing to make sure that is contained.
Looking at the type of exposure contact that these 25 cases would seem to display, what does it say then about how, for example, people need to respond to it? I mean, is it a risk to human health in general for the general public?
Well, it is a risk, but it usually affects particular people, especially men who are having sex with men, because it's by contact. People must just obey ordinary hygiene, like washing of hands and avoiding contact with people who might have been infected. The general hygiene measures which we used to use, for instance, during COVID, are applicable in this case.
And our case fatality ratio, is it high? Is it bad? What does it suggest? Are we able to respond effectively to the outbreaks?
No, the only people who passed on, unfortunately, are those who had very severely compromised immune systems. Those who have got normal and strong immune systems just recover from it. So we don't have any person who has got an intact immune system who passed on. All of those who passed is because of compromised immune systems.
Yeah. Let's turn, of course, to this weekend, which, of course, focuses by and large to human rights. We've just seen the 7th edition of the Constitution Hill Human Rights Festival that is taking place. But when we speak of the dividends, suppose, of democracy, or the social benefits, if you like, of a democratic society, we among the key issues talking about curbing inequality, the ending the oppression of the underprivileged, eradicating poverty, and, of course, upholding the universal access principle. Even more specific to your particular case as the Minister of Health is the question of HIV. Have you finally found each other in the GNU around that particular point? You're
confusing me. You said the question of HIV. Did I understand you
NHI, well? I beg your pardon. I wanted to say NHI.
Oh, I was surprised, yeah, when you said HIV. Look, what do you mean by finding each other?
Are you in agreement now
maybe,
on the principles of universal access and how we are going to get there?
Well, there's nobody in South Africa, at least of all the people who have heard speaking, I haven't heard anybody saying they are against the principle of universal health coverage. It's not universal health access, rather. It's universal health coverage, UHC, as adopted by United Nations General Assembly. I haven't heard a single person say they are against that. What their gripe is, they say they are against NHI, even though NHI is our local universal health coverage. They say they are not happy with certain aspects of the NHI the way it is, and they want them to change. Otherwise, they say they still support universal health coverage.
So have you reached any compromises, or at least are you aware of any of the parties saying, well, we would be amicable to it if these compromises are put in place?
Well, I don't know what's meant by compromises really, because there's quite a large number of people, Thabo, who say they support universal health coverage but NHI. Yeah. Each one of them mentioned their area of interest. For instance, you know that we have got 4 cases, one by Solidarity, which is an African movement. Obviously, their tendency will be to protect the Afrikaners. The other is Board of Healthcare Funders. Yeah. That's the second one, which is an association of medical schemes. Obviously, their interest will be about medical schemes. Yeah. The third one is the South African, is a group of specialists, those who are in the area of specialists in the private sector. Obviously, their interest is how to protect the field of specialists in this area. And the last group, which has just entered, is HASA, Hospital Association of South Africa. Obviously, they would like to protect private hospitals. So you've got different proposals depending on who is speaking or who has gone to court.
So let's look at that particular compromise, which you've already mentioned, around the medical aid schemes. Some reports suggesting that cabinet, I don't know whether it is really cabinet, but as in cabinet would have reached a compromise with the DA to say you've given them a guarantee that medical aid schemes will not be collapsed. Not that there was ever a real danger of that happening, but also a ministerial advisory council would be established. Would you say that is a compromise that you would have reached that is making this a little bit more of a palatable proposition?
I'm not aware of any compromise with anybody. The act has been passed, and it's been passed by Parliament, and we're busy implementing it. You may remember that during the State of the Nation address, the president mentioned 3 things. Number one, that we're on the HIV/AIDS field side, that we're going to look for 1.1 million extra people who are HIV positive but who are not on treatment. We have launched that on the 25th of February. The second thing he mentioned is that in preparation for NHI, we are going to put massive health infrastructure, and then the issue of human resources for health and quality of health care. We are busy with those. Now, the issue of not collapsing medical schemes, the Act never ever spoke about collapsing medical schemes. All the Act is saying is that once NHI is up and running, medical schemes won't be allowed to fund the areas already funded by NHI, because we will just be duplicating. When you duplicate, you spend more money in health. We are already spending more money in health than other countries. Why should you duplicate? There are people who don't like that. They say there must be competition between NHI and whatever medical scheme is there. There are already 71 of them, all competing in the field of health. We don't regard the field of health as competition, Thabo. Actually, we don't even understand why they are complaining when we say there must be no duplication. Because even now, that in some areas, that's happening, where medical aid funds something and the state fund the other, and the medical aids are not interested. For instance, in the field of TB, which is #1 killer of all infectious diseases, you are aware that next week, we are launching a campaign to look for 5 million people who must be screened for TB, and if positive, put on treatment. There are very, very, very few who will be treated in the private sector. Yeah. Even for HIV and AIDS, we have got the world's biggest campaign, as you know, of counseling and treatment. There are 5.5 million people. Private sector is covering only 6% of that 5.5 million people. The rest are covered by the state. You come to things like immunization. There is not much immunization or any I know about that is taking place in the private sector via medical schemes. Yeah. The immunization campaign are mostly carried by us. Even contraception for women. I remember speaking to quite a number of medicals are not interested. So that part of NHI is funding some aspect of diseases. Yeah. There should not be any duplication by anybody because we are talking about pooling funds for all the citizens in the country. So when people say we must reach compromise about that, it really confuses me what actually they want.
So are you speaking at crosshairs here with John Steenhuisen? Because coming out of SONA, you are saying exactly what you're saying now, where you said, well, NHI is in full operation. Besides, medical aid schemes have always been playing a complementary role as far as you're concerned, and they are going to continue to play that complementary role. John Steenhuisen at the same SONA comes out and says, well, we are not going to be a part of the destruction of the private medical aid schemes. If that happens, then we cannot be a part of it. Are you speaking at crosshairs? Do you understand what, are you on the same page in terms of what you're talking
about? Thabo, I don't know. NHI is not in full swing, as you are saying. We are still in the preparatory stages, I must emphasize.
Oh, the Act, I'm sorry.
There is nothing called full swing.
The Act is in full operation, yes.
Yeah, the Act is in full operation because it has been passed by Parliament. Parliament has never amended it. If it's so amended, yes, things will change. But secondly, because it's in court, if the court of law outlaws it, as some people are asking, or changes whatever, we will follow because we are a country that obeys laws. That's what we know, but it's not in full swing. But look, I don't understand when you say we are at cross purposes with Steenhuisen or whoever you have mentioned, because as I'm saying, this act was passed by the Parliament of the Republic of South Africa. It can't be changed by negotiation between two political parties which are in Parliament. It can only be changed by a Parliament itself or a court of law. I'm not sure what is confusing about that.
Are you as optimistic, I suppose, as the Deputy Secretary General, Nomvula Mokonyane of the ANC, that there are differences over particular sections of the NHI Act, but certainly optimistic that they will soon be ironed out?
Well, I don't know. It depends on the differences that you are mentioning. I've just told you that we have got 4 court cases. Each one of them mentions their area of interest. And any law, Thabo, gets amended, even the Constitution. It depends what are the areas to be amended and what is the reason and in whose interest. If people ask us to amend NHI in the interest of all South Africans, why should there be an argument if it's in the interest of all South Africans? But if people do it in their own interest or in the interest of a small select group, then it becomes a problem. For instance, Thabo, let's come to the issue of medical aids. They've been there for the past 50 years. They only cover 10% of the black population, 10%. But in the white population, they cover 72%. Obviously, somebody who has got that and the interest is the white population will say, don't change anything. Anybody who looks at the black population would like a change. We tend to accommodate an extraordinary number of people. That's what the word universal means. It doesn't mean a select group of people or people of a particular color or people of a particular income. It says universal, which means everybody, nobody must be left behind, regardless of their socioeconomic status. If the amendments are in that regard, they're well and fine. But if the amendment is about, please, I want to be protected in whatever change, and then I don't see exactly why we should go on with that.
Let's turn to those who are in support of the implementation of this process, that is how. They are saying, well, we are tired of hearing about these preparatory steps that are being taken while over 56,000 people die of TB, for example, annually. They are saying, we no longer want to hear that you're in preparatory steps or stages. We want to hear now that you have decisively promulgated the act and it's law and it's in full swing, as I said. How far are you from that?
I do not understand what you're talking about. Every plan and every project and every program need to be prepared for. There's no question about it. Even the act says so. It's not me. It's in the act. Then whoever is against that should have stopped the act from being enacted. The act, in certain sections, talk about preparatory steps of what committees you are going to put in place, what structures you are going to be in place, etc., etc. And the things like what we call caps that are being established in the districts about payments, that's preparation. I'm not sure why somebody can say, no, they don't want any preparation. It's like building a house. You start with preparatory steps. You remove the rubble, you dig the foundation, you do all that. That is all preparation. I'm not sure if you say somebody says they don't want to hear anything about preparation.
They're saying we no
what
longer,
actually do they mean?
I'm quoting as saying we no longer want to hear about preparatory steps while 56,000 people die of tuberculosis annually. We want to see the president act decisively in promulgating the act into law, ensuring full implementation of NHI as guided by Section 57 of the NHI Act.
Well, next week we are launching a program about TB. We have reduced incidence of TB since 2017 by a whopping 56%. We are now having a problem reducing the deaths, and it's because of the conditions under which people who have got TB are living. Next week, we are launching a program called the NTB campaign by the Deputy President. We are not waiting for any preparatory steps. Today, we've held a Senate plenary where we're planning for that with all civil society. Labor was there, civil society is there, business is there, government is there, and it's all systems go to launch the NTB campaign. So I'm not understanding exactly what that which you are quoting is all about.
Minister, let's leave it there. We're out of time. Thank you very much, as always, for coming on. That's Minister Aaron Motsoaledi.